and certain minerals. Apart from that, hormone like parathyroid hormone, and then bone markers. Bone markers means xenopeptide and then bone density. These are the most important factors. After the age of 40-45, everybody should undergo, should regularize the hormones and the vitamins so that the complications after the age of 45 with the osteoporosis disease should not happen. So, obviously we all of us know that how we get the calcium, that is through the diet. The proper taking diet is most important. How do you know? What are the symptoms you see up in this after the age of 45? Usually everybody complains about the pain on the bones, like shin on the leg. Usually everybody complains. Most of the people complains about the hair loss. And then most of the people with the trivial injuries. With the trivial injuries, falling from the sofa or falling from the bed also sustains major fractures. Such signs and symptoms we see, so that we should undergo the specific investigations to confirm the problems. Obviously, serum calcium levels should be above 9. Vitamin D levels should be above 30. And then parathyroid hormone levels. And then bone densitometry, which we can rule out whether the bone is weak or not. That means the strength of the trabecular pattern in the bone marrow. So these are the most important investigations you must undergo after the age of 45 till the end of life, at least every year once. So when you know that if there is a deficiency of the calcium, that should be supplemented through the medicines like calcium, and then as well as you should have the proper nutrition which has lot of calcium like green vegetables, milk products, etc. And apart from that, parathyroid hormone is a natural regulating body which maintains the resorption of the bone and formation of the bone. It automatically regulates the bone strength in the body. And then vitamin D is the most important, where the most of the Indians are not exposed to the sunlight due to not aware of the production of the vitamin D. The vitamin D is much more produced through the skin, the subcutaneous fat, the fat underneath the skin, which produce the killer calciferol or its hydroxy vitamin D, so that it strengthens the bone along with the calcium. Apart from that, we get some amount of vitamin D through the nutrition also. So these are the two factors we must know, and we should at least for 15 to 20 minutes a day. I mean to say, it's better stand in the sunlight, under the sunlight with less clothes on the body, so that larger the skin area absorbs the UV light, which produces the vitamin D through the subcutaneous fat. That is most important than the nutrition and other supplements. We have a lot of supplements which vitamin D3 can be taken once in a week, which supports who are lesser than 30. The calcium also, if it is lesser than 9, should be taken every day, about 500 milligrams, so that it maintains your regulation of bone formation of bone strength. So bone densitometry is the most important thing, which spine, leg, foot or the forearm bones can put on a machine, so that it detects whether you have bone density is lesser or more. So if it is less, it is called osteopenia. So hence, if it is osteopenic, then we need to supplement vitamin D, calcium and sun exposure. These are the most important things. The parathyroid hormone, which regulates the resorption and the formation of the bone, which is most important, which auto-regulates within our body. As such, if the levels of the parathyroid hormone is lesser, we must regulate with the supplementation of the medicine. We have a medicine, as usually we all know that certain medicines like calcium. At least you should have 500 milligrams per day, so that it regulates the quality of the bone. And then at least once in a week you should take the vitamin D supplementation, and then regularly you should have a proper nutrition which has a calcium, vitamin D and certain other nutrients, minerals like magnesium, potassium, and then other minerals like even which maintain the water content in the bone like sodium, potassium. So these are the things which are most important along with the maintenance of the bone formation, bone maintenance, bone quality maintenance also. So hence I suggest, because nowadays many aged people are suffering with the micro and major fractures because of trivial injuries to major injuries. I obviously in my practice every day see a old lady who had a small injury, trivial injury like falling down from the chair or bed or from the sofa, sustains major fracture like hip, neck fracture and hip trochanter fractures. Those are the major fractures, but the history of injury is very small. So obviously you must understand that because of the osteoporosis of the bone, the quality of bone is very poor, so that the fracture, such a major fracture is happening. Even certain people sustain a spine fracture where the spinal cord, the vertebral body, which because of the fall from the small heights, they sustain the compression of the vertebral body, a wedge compression fracture of the vertebral body in old age people. Luckily, they don't get sustained or injured to the cord because of they have a thick fibrous layer called the periosteum, which protects the cord. But in a major injuries, sometimes there is a possibility of injury to the spinal cord leads to neurological loss. So obviously, whoever is sustained fractures should undergo the major blood test, parathyroid hormone levels, and then calcium, vitamin D. And whenever there is a major fractures in old age, we should treat appropriately so that the movement is the life. Unless until you move, you cannot have the life. Because the maintenance of the muscle power, maintenance of the joint, maintenance of the bone. So obviously nowadays, the previous days we used to do a conservative treatment for such major fractures with the traction, springs and etc. But nowadays there are the system, the newer techniques have come, which can be fixed with the nails, plates, screws, so that such old ladies can be mobilized early, so that they feel more happy and they can do their own job. Apart from that, they don't trouble the family members. So obviously in this regarding osteoporosis, we all should aware of it and then take care of yourself. So is there any questions I can answer you?